So we can see that we have a few questions waiting. So to Jack, how about safety issue and increasing dose of linezolid in your patients? Is there any thrombocytopenia?
Yeah, we monitored that through the course of 3 weeks with our patient, and they didn't get any. I think very similar in this show around modeling this with the drug levels and platelet counts in a community to sort of extrapolate the likelihood of let it use on cytopenia, but yeah, it wasn't really at all.
Yes, this is also Jack about loaded dose. Too high for Asian patients. What do you think about the concerns of overloading the patient? You guys do that.
Yeah, there are adults where there are concerns. It's variable literature around like not understanding how to approach it. I think we would like in that case and in I guess when we're managing sepsis and septic shock, we would potentially move to treating them full dose, loading them full because we think that the risk-benefit ratio, that is, in terms of treating them liquid, they are at risk for MRT evidence. Obviously, you have to check which patients deserve getting that way when anything doing that. But yeah, completely understand our insults. It's difficult to formulate a plan for everyone, but there are the risk factors.
So I thought, just wondering, but I have any experience with my postmortem protein.
For dosed at 10 mg per kilo for mucor or CNS in obesity. I haven't personally, but the problem with mucor and CNS infections is the fact that we're not worried about the kidneys and necessarily the toxicity. So potentially going in and removing the cap, at least for the first few doses and watching, is something that we probably would consider, because the cap is mainly there for toxicities and adverse effects. So I guess it's just monitoring the patient for those adverse effects as opposed to it being for the efficacy. And for mucor and CNS, the importance is getting on top of it quite rapidly because they are life-threatening infections. But also to note that values that are going up above 7.5 milligrams per kilo per day, that the pharmacokinetics of ambisome becomes very non-linear. So quite often you may not find a huge amount of benefit going up above the 7.5 mg per kilo anyway dose, because it is unlinear. So it may be that you get a lot more toxicity. So I think maybe you could remove the cap but monitor for toxicity, but I'm not sure I'd go completely up to 10 mg per kilo.
Oh, thanks, Haifa. So maybe last one for Jack is there a resource available for what TDR is available for which antimicrobial and which side?
Relatable for Australia. And the other is, particularly is my edit. This is Mainland. All we do have a solid test list, so look that up. But in terms of around Australia, we have the ASA, the Society of Antimicrobials. If you look up their website, they do have a pathology test list and a contact. So, if you're looking for where that's a good start, but it's probably not easy to see. Yeah, because there are non-accredited assays in research laboratories, but that's I'm not unaware of.
And it's one more.
Yeah.
So Haifa, maybe two for you. So is there any published pop PK equations that it can include evaluate to help with the dosing adjustment of voriconazole once we have the trough level?
So that there aren't at the moment. I guess it's in terms of studying for pop PK for obesity, there are a couple of papers, but it's trying to understand for your own population in terms of sorry, I'm going round in circles. I haven't had enough caffeine this morning. So for the pop PK of the voriconazole, sorry again, there aren't many that would show in terms of that you could use for model informed dosing, if that's what you're talking about. And a lot of stuff with voriconazole, you can start off at a point, but after that it would be guided by TDM anyway. It's mainly the starting point, and then you would adjust subsequent dosing by with TDM, because it is again very non-linear, and there are a lot of other factors that can affect the PK of voriconazole, like I said, genomics being one, as well as drug-drug interactions.
Yeah, so I said the last, maybe this is last point. So the last, like, what is the difference between PK-PD target and TDM target, and do you have a cap dose for fluconazole?
So the PK-PD target, there's a beautiful paper that you wrote, Hafiz, that looked at with ECMID in terms of TDM of all of anti-infectives, and there was a recent also one paper looking at that TDM in obesity, and that one comes out from that latest one, which is a couple of months ago. So your PK-PD targets are what you're actually your indices, and then the TDM target is when we're looking at the trough levels, which I said correlates quite nicely for the azoles with outcomes, and that's be your TDM target, which often is trough levels with your labs. And again, that's not always accessible. It's trying to see what your lab has and what their reference ranges will also have. And bear in mind that some, especially on ITU with sepsis, they will be less susceptible, maybe less susceptible organisms. So understanding their MICs and whether you need to actually go for say a 2 trough level rather than a 1, for example, for voriconazole or isavuconazole. In terms of cap doses for fluconazole, there are no cap doses, but again, it's about monitoring the adverse effects. So, like you did mention about the liver and the QTC, you'd start off with that, and then again, you'd monitor the levels. With fluconazole, it's cleared by the kidney, so that will affect the way you will actually dose the patient as well.
Thanks, Haifa. So I would like to express my heartfelt gratitude to each and every one of you. Thank you again for attending this talk, and especially to our speakers, Jack and Haifa. And I would also like to extend a special word of appreciation to our sponsors, Pfizer and also Gilead. Before we end this session, I'd like to highlight a few events that are happening soon, which is the Anti-M Symposium. And don't forget that we have a lot of programs planned throughout 2023. So you can see the planned programs on our website. Please subscribe to receive invitations to our education seminars and programs. And if you miss this session, don't worry, because we are going to upload this on our YouTube channel, and follow us on our Twitter at CRE _respond. And also you can follow us on LinkedIn. So thank you again. And if you have any questions, just email, and then maybe we can ask our speakers and provide responses soon. So thank you again, and have a good night, everyone. Thank you.